That again. Good afternoon, everyone, and welcome to our February special edition of the Center for Health Equity Jam session, Black Health Equity History in the Making. My name is Dr. Lisa Cooper. I'm the director of the center, and it's my pleasure to welcome you all to join us this afternoon. Before we start, I just would like to say that this session is going to be co-led by myself and Dr. Deidra Cruz, who is the Deputy Director of the Center for Health Equity, and we have several special guests and honorees as well. So I'm going to start with an excerpt from the poem, "The Hill We Climb" by Amanda Gorman, just to ground us in why we are here today. And it goes like this. Scripture tells us to envision that everyone shall sit under their own vine and fig tree, and no one shall make them afraid. If we're to live up to our own time, then victory won't lie in the blade, but in all the bridges we've made. That is the promised glade. The hill we climb, if only we dare it, because being American is more than a pride we inherit. It's the past we step into and how we repair it. So with that, we're stepping into our past to remember our ancestors, those who went before us in this month of February, Black History Month, which was officially recognized in 1976 by President Gerald Ford, but it was really the brainchild of the famous Black historian Carter G. Woodson, who actually in 1915 founded the Association for the Study of Negro Life and History, and in 1926 sponsored the first National Negro History Week. And it occurred in the second week of February to coincide with the birthdays of President Abraham Lincoln and Frederick Douglass. The theme for Black History Month this year, 2022, is Black Health and Wellness. And the purpose of this theme is for us to explore the legacy of Black scholars and medical practitioners, but also those who are other healers and health workers throughout the African diaspora. So today we have our own special version of this theme, Black Health Equity History in the Making, in which we are going to honor several faculty, staff, trainees, and community partners, and recognize that our ancestors were just like us. They were struggling daily to make the world a better place than they met it. And they walked, in many cases, on the same soil that we're walking on and had many of the same struggles, heartaches, joys, and thrills that we have today. So just as they are history makers, we have history makers in our midst. So I'm going to turn it over now to Dr. Deidra Cruz.
Well, thank you, Dr. Cooper, and welcome, everyone. I'm really thrilled about today and just really this opportunity to reflect upon those of us really in our midst that we get to work with every day that are contributing to the legacy of certainly of Black health equity. We have coming up a bit of a musical interlude for you all as we shortly launch into our panel discussion that we are really excited to bring to you. So I will turn it over.
I may have turned it over prematurely to you, Deidra, right?
It's okay. It's okay.
Are you okay?
Yeah, I'm okay.
Okay.
Yeah, I think we're set with our musical offering. I don't know, did you want to cue this off, or I'm happy to?
Well, the only thing I will say is that we will be joined by the Morgan State University Choir, which is going to perform for us Lift Every Voice and Sing, the Black National Anthem, which was written in 1899 by poet James Weldon Johnson and his musician brother, John Rosamond Johnson.
Well, I hope we're all ready for a continuing sort of journey here of inspiration, already kind of kicked off for sure with Dr. Cooper's remarks, as well as the wonderful and amazing Morgan State University Choir. We're really quite fortunate to have them provide a rendition for us now for a second jam session. We had one kind of earlier this year. So really admire their work and are grateful for them. We are going to kick off here in a moment our special panel of honorees who are conducting work to help us advance Black health equity. And we're so excited to have them join us. I'm going to ask if we can project. Yep. their lovely photos here. So today we are joined, we're going to be joined by 4 panelists. One is a surgeon and may be joining us momentarily after a series of cases today, we're told, but he should be with us. So first, we're going to be welcoming Mrs. Debra Gales, who is a lifestyle interventionist, and we'll get to hear about her experiences in that work and really lots of other things that she does outside of her day job. We're also going to be joined by Miss Lois Dankwa, who is a PhD candidate, and we'll get to hear about her journey as well. We're going to hear from Mr. George Franklin, who is a patient advocate and a member of our community advisory board at the center, as well as for the 5+ Nuts and Beans for Kidneys trial. And we'll hear from Dr. Fabian Johnston, who's an associate professor of surgery, who is a faculty member here at the Center for Health Equity. And we have some particular questions that we're going to pose to them. And I think, you know, the motivation behind both highlighting these individuals, but also to the particular questions that we're going to ask is really to give us all an opportunity to hear from people who, like many of us that are tuned in today, have had quite a journey kind of across their engagement in work towards advancing health equity, and even including in particular Black health equity. And so here in this National Black History Month, we certainly want to highlight them and also be inspired by them. So I'm going to invite them to the virtual panel. I think we have a plan to pin everyone. Hopefully you all can see them. I'm going to switch over to my pinning. I see Mrs. Gales pinned. Oh, here we are, joining the virtual panel. We made it. Very good. Welcome.
Thank you.
And thank you again. And we're so honored to have each one of you. And so each of you have had this very, I think, unique path, particularly given kind of where you are in sort of the work that you have been engaged in. And, you know, I thought we could maybe just kick it off. And I'll go around. I'll make sure I sort of call on you when it's going to be your turn to sort of share with us. But I was wondering if you could share, and maybe I'll start with you, Mrs. Gales, Miss Deborah, as I call you during the daytime. If maybe we could start off with maybe if you could share a little bit about kind of what inspired you to do the type of work that you've done, and for those maybe that don't know much about the work that you do, maybe tell us a bit about that as you tell us about the inspiration for it.
Sure. I have always, since I was young, wanted to be in healthcare some type of way, but just didn't know where and how. And I ended up doing a undergraduate internship in dietetics at Hopkins. I was a student at Morgan, and we were selected. Some of us were selected. That was back in the old days. I tell the young people, when teachers could tell you what to do and professors. I didn't select that. I was in nutrition, and my professor came in and she pointed to me and this other young lady, and she says, "You're going to be in the CUP program, and you're going to be in the CUP program." First of all, we didn't know what she was talking about. And then when she explained that, what we did was we were in a CUP program, undergraduate dietetic program over at Hopkins. We formed a class. There were 2 of us from Morgan, 2 from University of Maryland, College Park, and 2 from Hood College. And we formed a class at Hopkins. So every Tuesday and Thursday, we were over at Hopkins all day long, learning different things and being exposed to every aspect of nutrition, which was wonderful. So that's how I ended up in the healthcare system. Now, as far as how I got into the health equity, is that what you want me to say? Well, Dr. Cooper has heard this before because when this was first formed, I told her my little story. It was a personal experience where I'd made some appointment, doctor appointment for my children in my neighborhood because I live in Baltimore. And there was a doctor nearby, Garwin Medical Center. And I said, well, we'll go there, we can walk. So we went, we made the appointment, we walked down there and oh my God, the appearance of the office was terrible. The room was overcrowded. The healthcare person who was, I don't know if she was a nurse or receptionist or whatever, she was not customer friendly. And I was like, what in the world is this? So we did go to that appointment, but I looked up that same doctor, which I knew had another office in the suburban area. And I looked up that one and we made an appointment to go to the suburban office of the same doctor. What a difference. It was very nice, very light. They had aquarium. They had things for children to look at. We didn't have to wait long for the appointment. The person was kind who came to, help us out, to register us and whatever. And I said, what a difference. And at that point, I said, I am blessed that I can go anywhere I'd like to go. But what about other people that may not have the insurance, may not know and whatever, and they can't go other places? And I said, that's just wrong. And that's what spurred me on to work in the Health Equity, Center for Health Equity, or something like that, when the center came about. And that's what got me there. And as far as sustaining me there, I feel it's a ministry to me, because I enjoy helping others and I get so much out of helping other people. I don't want to keep talking.
Thank you so much for sharing that. Thank you. Lois, I'm going to come to you. So I know you're a student, so you're maybe a little bit earlier in your work, but tell us sort of what inspired you to do to get trained in and do work in health equity.
Sure. So I think it's kind of a combination of a lot of different pieces kind of from my life and just growing as a person and being trained in this space. So I'd say healthcare just was always a topic I was interested in. It started as initially wanting to practice medicine, and then I realized kind of my strengths and my interest in it changed to kind of studying health services. But I think all of that is guided by just me as a person. I'm aggressively empathetic, so it hurts my heart to see other people struggling. So then it kind of drives me to go, okay, what can I personally do to even help a little bit? Also, just being born a child of immigrants in the US, seeing kind of how our family, even our access to healthcare resources has changed as our family has kind of gotten more access to things. We have been able to get more things as a result of my parents kind of being in the US for longer and getting more education and living in new neighborhoods and environments, and just even being aware of the difference from our own lives in terms of areas where we struggled before but don't anymore. It helps me see that there are people who are still in challenging circumstances, or people who still are working really hard but aren't getting their needs at large met, but then also their healthcare needs in particular met. And then also as an undergrad student, I lived in West Philadelphia, and kind of taking all of the things that had built me as a person, and then being in that moment, I was volunteering and working just in the city. And I just, again, I know Mrs. Gales, you mentioned this, but it's kind of, I noticed differences in resources, and I noticed how in some parts of the city, things worked out great for everyone. There were so many resources, but in other places, it was so decrepit, and people were struggling in ways that I didn't think was necessary, because to me, the point of systems is to really meet people's needs when there is that deficit. So that's really what's inspired me to do this work. I think what's kind of sustained me and kept me in this space is being aggressively hopeful and idealistic. When I was younger, I had a teacher once tell me I was overly ambitious about a particular project, but I think it's that kind of overly ambitiousness that's keeping me in this space, knowing that, I mean, I just think it's possible. And then I also keep meeting people that continue to inspire me. So many of the people on this call that are listeners today, even just their work, they continue to inspire me to keep at this work, and it just feels very solvable to me. So yeah, that's why I got inspired, but that's why I continue to get inspired as well.
Thank you. I'm going to credit you with what may be the hashtags of the day that I just put in the chat. Aggressively empathetic, aggressively hopeful. That's really fantastic. Thank you for sharing with us. And then Mr. Franklin, we can't see you right now, but I hope you can come back. I hope we'll get him back here in a second. There he is. Okay. So George, I know you come at this from I think quite a unique perspective. So we definitely want to hear from you what inspired you to get engaged in work trying to advance health equity. And you're muted right now, George.
Mute.
Oh, there you are.
We go.
Okay.
There we go. Sorry, I don't know if you can see me. I've had trouble with Zoom. If someone on the call knows how to run it, let me know, because I've got 2 laptops. It freezes on both of them, and now today on my telephone, it's freezing up. So I don't know if you can hear me in that, but
we can hear you. We can hear you perfectly, okay. Actually. Okay. Yep.
Yeah, it's a little different for me, although I appreciate what Deborah and Lois have gone through, because so much of my life has been in the focus of trying to help others. And when I was asked, I believe by Patty Dash of the National Kidney Foundation to join this committee, it did excite me. Anytime I can help anyone, and a lot of times it's just disseminating information, then I will do it, whatever it is. I am a kidney transplant recipient. I go back far enough to remember when there weren't too many people of color even getting the medical care that the machines provided. We called them the kidney machines. Back in '72, when I started right after high school, you were not chosen to be on that machine unless you were generally white with a family that you had to support and that you were supporting, you were working, you were important. And so that, I think, was my first exposure to health inequity. I mean, it goes back that far. I live in Cumberland, Maryland, which is a predominantly white town. And even when we were getting when the vaccines came out, I couldn't seem to get one. As a person with no immune system, I came behind everybody that was above me as far as age, behind the nursing homes, the hospitals. And I know we want to protect our healthcare providers, but I said, my God, what do I have to do to get a shot in this town? And so I ended up driving all the way to Baltimore to get my Johnson shot. They were doing Johnson that particular day. And so even out here, I feel that there is health inequity, certainly, down where you guys are in Baltimore and so forth. But it's frustrating when you see it, when you experience it, even more so. I had a doctor here that made a bad call, put me in the hospital, and all my life, I've had probably 15 surgeries, and I've never had that to happen when I was living in DC. And the very first time I had to experience a doctor making a decision over me, it landed me in the hospital because of an inappropriate pharmaceutical change. So that's why I'm here.
Thank you. We're grateful that you're here, and but thank you for sharing that. Well, we're going to give our panelists a slight break as we go over and actually here in a moment highlight some other honorees that are members of our center, friends of the center, former trainees of the center. We're, as we talked about earlier, going to just really be celebrating the numerous contributions that people here within the Center for Health Equity and our community partners, our members of our community advisory board as well, have contributed to helping us advance health equity. And so we're going to start projecting those here. Great. And so first up, we want to honor Dr. Anika Hines, who was a Center for Health Equity trainee and is now an assistant professor at Virginia Commonwealth University, and we're fortunate maintains an adjunct appointment here at Hopkins. She's received numerous awards and has been a really important member of our 5+ Nuts and Beans for Kidneys trial, wherein she's led a ancillary project that we have been really excited about, and as well as receiving recently an NIH award to continue to advance her work. We also want to celebrate Dr. Yvonne Commodore Mensah, who is an assistant professor in the School of Nursing. She has been a Center for Health Equity faculty member for over 5 years, and currently leads 2 studies at the center, one the Linked Hearts trial as well as the Linked BP trial. And she also has been the recipient of numerous honors. We want to celebrate Ms. Michelle Simmons, who is a patient advocate and a longstanding charter member, if you will, of our community advisory board at the center. She is a core member of our new award, the Mid-Atlantic Center for Cardiometabolic Health Equity grant. She was featured, as many of you may have seen, in the Johns Hopkins Medicine video, Michelle story. If you haven't watched it, maybe someone could drop that in the chat for folks to see. And she has received other honors as well for her contributions. Next, we'd like to honor Dr. Chidima Ibe, who is an assistant professor in the School of Medicine, and she is the associate director for patient and stakeholder engagement at the Center for Health Equity, and has been a longstanding member of the center, but a core faculty member or faculty member since 2018. She's a recipient of an NIH award for KO1, and she's the co-director of the Community Engagement Core for our new award from NIMHD. Next, we'd like to highlight Dr. Raquel Greer, who is currently a program officer at the National Institutes of Health, at the NIDDK in specific. She was at Johns Hopkins, though, for many years prior to that, and was a faculty member at the center, really from the early days of the center, and received numerous awards during her time here at Hopkins. Next, we'd like to honor our very own center director, Dr. Lisa Cooper, who's of course the founder and director of our center. And she's well known for having pioneered relationship-centered approaches to helping us to advance health equity, and has received numerous awards, and is the author of a book that was released last year called Why Are Health Disparities Everyone's Problem? I hope everyone has read that book. If not, you should. And most recently, she was appointed to the President's Council of Advisors on Science and Technology. And next, we'd like to honor Dr. John Jackson, who's an assistant professor in the Department of Epidemiology in the School of Public Health, and he's been a part of the center now for the last 5 years as a faculty member, and has received numerous awards, particularly around his research work in epidemiology, and is a KO1 awardee from the NIH. And next, we'd like to highlight Dr. Oluwaseun Falade Wulia, who is an associate professor in the Division of Infectious Diseases at Hopkins, and has received numerous honors for her work around viral hepatitis, and serves as a co-editor of a recent feature series focused on systemic racism and COVID-19. And next, we'd like to honor our very own Farmer Chippy, who is the executive director of the Plantation Park Heights Urban Farm, and he's been a community advisory board member at the center for the last 2 years. Farmer Chippy, just this past year, was honored with his farm being named one of the top innovation teams in the USA through the Urban Farm Bureau Federation, and he's also had his work featured in a number of news outlets, including the Washington Post. And next, we'd like to honor Dr. Rachel Thornton, who was at Johns Hopkins for many years and served as Associate Director for Policy, and recently stepped down from her position at Hopkins to become the inaugural Chief Health Equity Officer at Nemours Children's Health, where she'll be beginning, I think, in just a matter of days there in that new position. And next we'll honor Dr. Chiadi Ndumale, who's an assistant professor of cardiology in the School of Medicine, and is the PI of one of our new projects, the Unload Heart Failure Trial, and he's received numerous awards, including for his excellence in mentoring trainees. And then next, we'd like to honor Mrs. Jacina Barber-Wise, who is a research program coordinator at the center. She just joined this past year, working with the 5+ Nuts and Beans for Kidneys trial. Before joining us in the center, she had a really wonderful career serving and advancing health equity in a number of different areas, including through work at the Baltimore City Health Department. And then we'd like to honor Ms. Devin Brown, who has been at the center as a staff member since 2018, when she is not staying very, very busy leading our engagement efforts with our community advisory board. Devin is also the co-founder of Fuel the Kids, which is a community service initiative focused on empowering Baltimore youth. Then we'd like to highlight Dr. Crystal Brown, who is a postdoctoral researcher and center trainee for the last couple of years. When she's not busy conducting her research, particularly focused on advancing health equity for Black women. She is the founder and owner of the Black Women Cachet, which is an organization that's focused on highlighting the experiences of Black women through narrative projects aimed at a range of different areas. And then we'd like to highlight Dr. Tangela Purnell, who is an assistant professor of epidemiology and served for 5 years as the center's associate director of education and training. She's received numerous awards, including an NIH KO1 award, and was named a top 40 under 40 leader through the National Quality Forum. So this ends our first segment of honorees, and I'm going to bring back the wonderful panel. I hope they had a chance to get a sip of coffee. And are geared up for our next question. I promise you, for those that are tuned in, that you'll have an opportunity to also ask our panelists some questions as well. They may not be ready for that. I didn't mention that might happen at the end, but they seem like the type that stay ready, so they should be good. All right. So our second question, you're preaching to the choir here in many ways. These are all, the folks tuned in today are all people who are engaged in this work of health equity or looking to get engaged, right? And so looking to learn from you and your experiences through a lot of these things that we'd like to talk about today. And so one of the things I think certainly I'm curious about and want to hear from you is what's something that's been a challenge that you've encountered and sort of had to overcome in in the area that you've been working in or in the work that you've been doing. And maybe I'll start with you, Ms. Dankwa, Lois, if you want to kick us off with that question.
Yeah, definitely. So I think one of the biggest challenges for me is kind of communicating the need and value of health equity work and work towards achieving health equity. Or maybe it's even creating buy-in that it's something that should be in the core of all solutions that are related to healthcare and healthcare services. What I've noticed, even just as I develop my own dissertation, it doesn't seem that it's something that's prioritized in all streams of work that aim to kind of impact health outcomes. And that's something I notice, even if health equity is something that's important to someone at their core. I've noticed kind of the difference between kind of fundamentally believing that health equity matters and it's like an individual core principle. And I've noticed how that's still different from how it's ingrained in people's work. So for me, it's been more of people aren't necessarily walking the talk, but it makes me think about how can that happen and how can people do that better, even if their work isn't so directly related. How can people realize that it has to be, otherwise to rely on health equity people in quotes is insufficient to me.
Well said. Wow. Thank you. So Mr. Franklin, I want to come to you. What's been challenging for you? So in terms of in your engagement and your advocacy efforts, what's been challenging? You're on mute again. We're going to get you that Zoom help, I promise. Okay, there you go.
I'm sorry. I think the most recent challenge has been with the COVID situation. Again, living in a red county where a lot of folk here don't think as I do as far as getting the vaccine and protecting one's self and others. I've had conversations with people trying to figure out, okay, where's your mind on this? Why do you think this is still some kind of joke? Outside of that, I've had no specific issues recently. But that has, I mean, it's been 2.5 years just trying to get people to understand the importance of the vaccine. I've had a conversation with several older friends, and we all remember when we were kids having to take vaccines before you could start school, you know, and you didn't have truckers riding up and down the roads, blocking highways and things, and some of the crazy antics that people have done because they don't want to wear a stupid mask. I think that's it. And I meant to say hi, Patty. I saw that go across the screen, but Patty is a very dear friend, and she has helped me so many different ways. And I think even some of her help has cleared up some health inequities that I've faced. But I think just in the last couple of years or so, with family, with friends, trying to get them to understand the importance of trying to get this vaccine into their systems. Yeah.
Thanks. You're really bringing it to the current day issues, right? This is a very real sort of thing that so many are dealing with, and we love to hear that CAB members are supporting one another, and we know that Mrs. Dash was the one that introduced us to you, so we're grateful all around for that. So wonderful. And then Ms. Deborah, what would you say? What's been challenging in your work?
The challenge in my work, and I, even though I may jump to the other question, I agree with George and Lois. Some of the things that they're talking about, I think we may have to go back old school, like we were doing with the COVID when they came, and trying to get accessibility to the shots and making appointments. There were actually people from community groups, medical people that were actually going door to door and
Yes.
talking to people, pastors from churches, talking to people. We do so much with our technology, but people want to talk to another person. And
Yes.
especially the older group, in that group, I want to talk to a person. And when that person can explain to me, you know, why we're doing this and that type of thing, it means a whole lot more than reading something on the computer that's telling me.
Right.
And I'm just thinking that we, you know, we just need that human touch. And one of the studies that I worked on was the ACT study, where we actually had to go into people's home. I worked as a community health worker, which I had never done that type of thing before with that title, and found out that I was going to have to visit people in their homes. Well, at first, I mean, I was uncomfortable. I was like, oh, I have to go to people's homes and talk to them. But I learned so much from doing that, and people that had difficulty, you know, getting their appointments or even believing that they needed to come in for appointments, we had a chance to talk to those people face to face. If your blood pressure is in this range, you need to talk to someone, and this is why, you know, and even making the calls for them to the nurse in the clinic, so that they could talk to the nurse one-on-one. So a lot of this interpersonal, the interpersonal reactions and connections with people, I think, are very important.
Wonderful. Thanks for sharing. And you highlighted the Achieving Blood Pressure Control Together study, one of the center's earliest projects. So this is wonderful. And you all have earned yourselves another intermission as we honor some other Black health equity history in the making honorees. So I'm going to turn it over to Dr. Cooper to honor that group.
Thank you, Dr. Cruz. Yeah, I'm thrilled to be able to begin to honor and highlight another group of history makers in the making here at the Center for Health Equity. Actually, one of them was the principal investigator of the Achieving Control Together study, Dr. Ebony Brewer, who we don't have in this batch, but she certainly is one of our health equity history in the making heroes. Down at Duke University now. So we want to recognize and celebrate Dr. Carmen Alvarez, who is a current Center for Health Equity faculty member since 2017, who has received numerous awards, as you can see here, from the Robert Wood Johnson Foundation, Urban Health Institute. She has been involved in co-developing our community health worker care management training program, along with Dr. Chidima Ibe and the rest of our Rich Life team. And her work focuses on developing interventions to address barriers to mental health care as well as cardiovascular treatment among Latina immigrant women. So highlighting Dr. Carmen Alvarez, who is an associate professor in the School of Nursing here at Johns Hopkins. And our next honoree is Dr. Roland Thorpe, who is a friend of the Center for Health Equity, a Johns Hopkins University professor in the Bloomberg School of Public Health, who has had numerous achievements, as you can see here, has received the AMTRA Teaching Award, Advising, Mentoring, and Teaching Award from the Bloomberg School of Public Health, also a Dean's Award for Distinction in Faculty Mentoring, and leads multiple large research grants in the area of men's health disparities, as well as health disparities among older persons. So celebrating Dr. Thorpe. Our next honoree is Dr. Dennis Antoine, who is an assistant professor in the Department of Psychiatry and Behavioral Sciences here at Johns Hopkins Center for Health Equity faculty member since 2015, who also is doing amazing work in clinical practice as medical director of the Cornerstone program at the Helping Up mission, as well as significant community service work. He most recently achieved the Levi Watkins Junior Ideals Award from Johns Hopkins Medicine. Celebrating Dr. Dennis Antoine. Next, we have Ms. Marlena Fisher, who is a trainee, a current CHE trainee and PhD candidate at the Johns Hopkins School of Nursing. And her accomplishments include a pre-doctoral individual NERSA grant from the National Institute of Nursing. She's also an emerging leader at the American Association of Colleges of Nursing. And her work focuses in the area of gender and racial justice. So she's gotten an award from the School of Nursing for that. So celebrating Ms. Marlena Fisher. Next we have our own Dr. Deidra Cruz, who is a professor in the School of Medicine and deputy director of the center. And of course, our esteemed moderator of today's event. You can see Dr. Cruz is very passionate about her work in the area of food and social determinants of health inequities for persons with kidney disease. She has received numerous awards. One of them most recently was the JHU President Frontiers Award, which is a highly, highly coveted award among the faculty here. And she's also done extensive work in the area of diversity and inclusion for trainees, as well as being the PI of several studies and the new co-PI of the Mid-Atlantic Center for Cardiometabolic Health Equity, funded by NIMHD. And this is something I didn't know about. She will be the first Black president of the American Society of Nephrology in 2024. Wow. So bravo to Dr. Cruz and celebrating her. Now, next we have Dr. Michelle Ogunwoli, who is an assistant professor in the Division of General Internal Medicine here at Johns Hopkins, whose work focuses on maternal health disparities and whose accomplishments include being a 40 under 40 leader, the National Minority Quality Forum, as well as a member of the Baltimore City Fetal Infant Mortality Review Committee, and a selection to the National Institute on Minority Health and Health Disparities Research Institute. She was a trainee at the center and will hopefully be joining us as a faculty member at the Center for Health Equity very shortly. And we have Dr. Keisha Pollock Porter, who is a friend of the center and a faculty member in the Hopkins Center for Health Disparity Solutions, Bloomberg Centennial Professor, also recently appointed as chair of the Department of Health Policy and Management, the first Black woman to be appointed to such a role at the Bloomberg School of Public Health, among many other awards, including her 50 Women to Watch Maryland, Mentoring Teaching Recognition Awards, Distinguished Alumna Award. So just an outstanding colleague. Celebrating Dr. Keisha Pollock Porter. Next, we have Dr. Sharita Golden, who is our faculty member in the Center for Health Equity, one of the inaugural faculty members of the center, and formerly the training director prior to Dr. Purnell. She's also vice president and chief diversity officer at Johns Hopkins Medicine. She's received numerous awards, as you can see, and distinctions for her research in the area of diabetes, but she's particularly proud of her work in advocating and testifying to Maryland for passage of health equity legislation and for working to develop culturally inspired community COVID-19 vaccine education. Celebrating Dr. Sharita Golden. And next we have Dr. Nakia Showell, who is a current CHE faculty member and a former center trainee. Dr. Showell has been recently appointed medical director of the Harriet Lane Pediatrics Clinic. She's also associate program director of the pediatrics residency program here at Johns Hopkins and has received numerous awards. She's currently leading a project of the BUILD project in collaboration with Morgan State University and BUILD, and also leading a newly funded project, co-leading with Dr. Ibe, funded by the Johnson & Johnson Foundation. Celebrating Dr. Nakia Showell, Assistant Professor of Pediatrics. Next, we have Dr. Erica Shelton, who is an assistant professor in emergency medicine, who is also a Center for Health Equity faculty member, and who has been very involved in this community in Baltimore including serving as a board member for Rebuild Metro and as a commissioner for the Maryland Community Health Resources Commission. She's also health equity faculty lead at Johns Hopkins Hospital for their advisory committee and has been involved in the Diversity Council for the Hopkins House staff. So Dr. Shelton is also a member of our Community Engagement Corps for the Match Center. Celebrating Dr. Erica Shelton. And now we are celebrating Mr. Leon Purnell, who has been a community advisory board member here at the center since 2010, since its inception. Mr. Purnell is the executive director of the Men and Family Center Incorporated, which he founded. And in 2019, he received the Maryland Legal Aid Equal Justice Award. So we are so proud and fortunate to have Mr. Purnell as one of our community advisory board members, very long-standing, celebrating Mr. Leon Purnell. Next, we have Reverend Dr. Mankikolo Malangu Nkobo. We sadly lost Mankikolo in 2019, but she was a longtime CAB member, community advisory board member, and we carry her legacy with us today and always. She was a freedom fighter with the African National Congress in South Africa. She also founded the Califong AME Church here in Baltimore and was a very active member of the Baltimore anti-apartheid movement. Also served as adjunct professor of the Morgan State University. So honoring and the memory of Reverend Dr. Mankikolo Malangu Nkobo. And next we have Dr. La Princess Brewer, who is an assistant professor at Mayo Clinic, but was a CHE trainee from 2010 to 2012 and continues to collaborate with us, working in the area of community academic partnerships, particularly working with faith-based organizations, has received numerous honors, as you can see, nationally, as well as in Minnesota for her work. She's a cardiologist, but received her early training here at Johns Hopkins. We're honoring Dr. La Princess Brewer. And we have Dr. Janice Bowie, who has been a CHE faculty member since its inception. She is a Bloomberg Centennial Professor in the Johns Hopkins Bloomberg School of Public Health, also the director of the DRPH program, a nationally recognized expert in community-based participatory research with a focus on Black churches. She formerly was an academic co-director with Ms. Lee Bone of the W.K. Kellogg Foundation Community Health Scholars Program and is a passionate and avid mentor. So we honor and celebrate Dr. Janice Bowie. And I believe this is last, but certainly not least, Reverend Deborah Hickman, who has been a Center for Health Equity member since 2011 and has served as our Community Advisory Board co-chair for over 10 years. Reverend Deborah Hickman is a founder, president, and CEO of Sisters Together and Reaching, or STAR. They are the annual hosts of the Why Women Cry series. This is a conference that brings together artists and motivational speakers and health professionals and healers to inspire and educate women in Baltimore. She's the recipient of numerous awards, including the NAACP Thurgood Marshall Legacy Award, City of Baltimore Guiding Light Award, Daily Record Maryland Top 100 Women's Award, and she continues to work with the Urban Health Institute here at Johns Hopkins as its co-chair of the Community University Coordinating Council, and has been relied upon by several people at the federal level, including the CDC and the Department of Health and Human Services. So we honor and celebrate Reverend Deborah Hickman. And there are so many more that we could have mentioned, but we would have been here for the rest of the day. So I just want us to take a few minutes to just recognize and applaud all of our honorees, as well as those we were unable to mention by name, but we've been so inspired by all of them. And we are just honored to have them in our midst. And we want them to know that we are here to continue to support you. And we look forward to many, many more years of partnership together.
Thank you, Dr. Cooper. Wow, what an amazing group of people we have worked with and get to work with and learn from. I'm definitely feeling inspired to keep going. I'm feeling what was the word? Emphatically. What was our hashtag?
Aggressively.
Aggressively.
Empathetic.
It was aggressively hopeful.
Yeah.
I'm feeling aggressively hopeful is what I'm feeling. So thank you so much. So let's have our panel return. Welcome back. Glad you made it back. We can all unmute. George, we apologize. We did that to you a moment ago as far as your muting. So, but I hope you can you can unmute again. So have another question for you. So kind of forward thinking on this one. What would you say, in either your work or where you think society needs to head, right? Tell us a little bit about, and I'll start with you, George. What do you think needs to happen next? Where do you feel like, we in either our work together, the work that you're doing, society more broadly, where should we be putting our energy in order to try to achieve health equity?
Ooh, well, I want to congratulate all the honorees first. It's amazing to know that I'm old enough to have been born and on dialysis and get a transplant before they were even thought of. And so to see all of those young people, it's just amazing. I mean, the 40, under 40, obviously I'd be older than they are. So that's really fascinating. Where would I go? I'd have to say general health care insurance. I think that no one in this country should have to go without health insurance. I mean, I don't see how there can be health equity if you can't get insurance to go to the hospital, or you go to the hospital and you end up with a $10,000 bill. Just 2 weeks ago, I switched my own Medicare insurance to a Medicare PPO, I think they were called, with Humana. Well, my doctor wants me to come down to DC to have a renal artery scan, which Humana says they don't cover. And I says, well, what number do I dial to go back to my Medicare? So it took me 4 days to do what needed to be done, but I did go back to my Medicare, which I knew would cover such a procedure. It's a simple scan. But so I think first we should look at making sure that everyone can go into the hospital knowing that they are covered, that they will not lose their home or have some other traumatic issue because they get sick. I mean, as an African-American, I try to tell people, don't wait until you're sick to go to the emergency room. I mean, that's why we've got some issues with healthcare in this country, because that's what we do. We wait until we get sick. We go to the emergency room. We might follow up with what goes on, but that's it. We don't get continuous healthcare, in other words. I think that's where we need to go. We need to go to a full standard. Everyone's insured. This is the cost, or this is not the cost, but let's get everyone insured.
Okay, I like it. Thank you. And Lois, what about you? Where do you feel like we need to head next to or sort of focus our energy towards achieving health equity?
So part of my answer is a bit of bias because of the work that I spend time in, but so a lot
That's
of
allowed.
Good. So a lot of my work focuses on teamwork and collaboration. And while I'm not necessarily saying people should do the type of research that I'm doing, I think teamwork and collaboration is something that it kind of touches on something that Miss Deborah mentioned earlier, kind of the human component and going back to talking with each other. I think in whatever kind of field or aspect of this healthcare space you're in, whether it's research or in practice, so clinical or community services, and even in policy, how can you tie it back to kind of working together in a way where you can be aware of kind of where you're coming from and your strengths, but then going, okay, how can I work with someone else or another team to kind of fill the holes in how I'm addressing issues as it relates to healthcare? Even though I am really hopeful that different streams of work can incorporate approaches to health equity, I recognize that it may not be realistic for certain streams of work to ingrain it in such an aggressive way, but it's about going, okay, well, who are you talking to make sure that the outcomes of your work are still going to appropriately move towards health equity. So for me, it's really just in research, practice, and policy, just assuring that teamwork and collaboration are a main part of your approach to developing solutions and kind of thinking through your work efforts, and just having the right people and team members kind of at the table to learn and develop.
Wonderful, thank you. So Dr. Cooper is saying in the chat, you're speaking her language, and she said relationships, partnerships, and collaboration are the threads that tie us together in achieving the vision for health equity. I will say it less eloquently and just say what I heard was teamwork makes the dream work when you were speaking. So so I think we all got the message. So wonderful. And then Miss Deborah, what do you think? Where should we be heading? Where should the energy go around health equity?
I agree wholeheartedly with George and Lois. I think we're all talking the same thing when I talk about the personal relationship. And then I was thinking, I don't know, in some places they may have had navigators. I would call them navigators. They could come under social work. They could be located in hospitals and clinics. They could be located in community groups, community action groups, neighborhood committee. Because as George said, he called because he wanted to get back on his other insurance because he knew that they would pay. Well, there are a lot of people that don't know that. And a lot of people that would not take the time to sit down and call and don't have the patience to call and maybe sit on the phone forever. With these navigators, if a person had a need and they went to their doctor or the social worker got referred to a social worker, they would have a navigator that would make these calls with them and sit on the phone and wait. They would have the patience so that the person could get the care that they needed, and not sit back and, people say, oh, I can't sit on that phone, that type of thing. And then they don't call. And so then their health fails. So I mean, that's what I'm thinking, navigators.
Right. I think we're all sort of, you are all kind of joining around the same themes here. Well, there's a lot of energy in the chat. One, just sort of celebrating you all and thanking you for your remarks. But I do want to open it up if you're willing, and I hope you are. If people do have questions, you can put them in the chat. You can unmute. I think we're a small enough group if you want to unmute and ask a question of our honored panelists today. The floor is open right now for those. Everyone's cups are so full. They just, with inspiration.
I'll ask a question.
Sure. Is that Mr. Purnell?
Yes.
I thought that was your voice. Okay.
Congratulations to all of the honorees. I was surprised to see my name jump up there. I've been doing this mess for a long time, and we've been talking this talk for a long time. I think some of you feel what I feel. It's time for all of these organizations and these fine young doctors and PhD professors and so forth to come together and collectively go after some real changes in the health field. We talk it a lot, and there's a lot more that we can do. we talk about collaboration, social determinants keep a lot of people from getting decent health care. A lot of people talk about it. I try to address those things because that's needed. And most of them don't have a clue as to how to approach it. If we don't start coming together, all of these young minds that's got a lot of time to pinpoint some things, we can go collectively to the legislative body and start looking at systemic changes. Because it's so many things. We talk about George's situation. He lucky he get any care, even in this day, up there where he's at. And it happens in the city as well. You know, if you're not affluent, if you're not well spoken, you're pushed to the back. And often you're pushed out the door. So, you know, we talk about changes. Most people that know me know I don't like to do a whole lot of talking. We need to start doing some walking. If it takes for us to go to Annapolis or down to Washington, D.C., we need to go. We need to look at some things that we can get this low-hanging fruit down there a lot of times. You have many medical gains that you have amongst the people that was honored and talked about, and that's what it's called. Collectively, if we take it to them, we can get some changes. But if you keep doing it in isolation, you gotta wait 20, 30 years. Some people look at how many people die in that time period. Right. So, you know, I heard all of your presentations, and I agree that we know that there are problems. But what are the solutions? That's the key. What are the solutions? Because we talk about problems all the time. So sometimes I hate getting on these calls because all I hear is, you know, people talking about the problems. But nobody wants to sit down and make a concerted effort to address them and try to solve some of them. Can we get some policy changes? That's what I'm interested in.
Well, thank you, Mr. Purnell. You're giving us a call to action, and I think we all heard that for sure. And I think you've been around this. Many of us in this group long enough to know we're like you. Some of us also like to talk, but we also do like action as well. So I think we're all with you on that. I see Reverend Hickman has her hand up, and also Mr. Purnell, do not be surprised that your face was on one of those slides. So don't be surprised at all. But Reverend Hickman, I see you have a question or comment there. I'll turn it to you.
I have a comment, and I do agree with Leon in part, if not in total whole, but I want to say thank you to Dr. Cooper, because Dr. Cooper has, down through the many years that I have known her, always had the brightest team of young people, as well as those that are middle age and young at heart. And I think that she has been working hard with her team to bring about solutions. I think that one of the things that needs to happen now is that we need to listen to the voices of the community members, such as George, and make certain that we are helping them to understand that we talk a different language in our rooms where we go to meet. That so much so that a lot of the community doesn't understand when you say community, when you say health determinants. Determinants means that you've already set in motion that this is going to be the end. But I like the term social influences. What are the things that influence our community members, and how do they gain the information and the resources, such as Debra Gales somewhat spoke to, and how to utilize those resources once they are acknowledged and they have a full understanding. But if we're going to continue to use the verbiage that we use, we need to make certain that we're putting booklets out there for the community to grab hold of, so that then they would become more engaged in understanding how to use their insurance, how to, access the resources that are available to them. That's a responsibility that we in the institutions as well as in our organizations have a responsibility to our community organizations, no matter what zip code they live in, but more so, we need to hear their voices and know their stories and be able to make certain that we are directing them in the right spaces to go and get the help that they need. I think we would see a major change in our utilization and how it's utilized, and we would have less of intake into the emergency departments.
Mm-hmm. Yes.
Thank you. Thank you for those words. I think I saw one question in the chat that I want to sort of offer to the panelists. I don't see any other hands up. Let me know if someone else does, but
there was one question from, I believe it was from Fatima.
Right. Yeah.
About how to get started when the problem seems overwhelming.
That's exactly where I was. That's exactly where I was headed. I was going to invite our panelists as we give you a chance to kind of give us some words of wisdom, as I think we'll, with this final question, we'll close out for the day. But wondering if you, in sharing your words of wisdom, perhaps respond to that question around like how do you get started with this, for those that may be earlier in this work than perhaps you all are in your experiences. So I can go first to you, George. I see your hand there.
The first thing I would say is follow your passion. We have mentoring programs for transplant recipients, for instance. There's so many people that need to understand how do you navigate to get a transplant, for instance. What do I need to do first? And that's been my passion, is to make sure that if I find out that they want a kidney, if there's anything that I can do to instruct you as to how to go here and how to go there. The gentleman was saying, trying to get healthcare up here. I come to DC or I go to Baltimore if I want excellent healthcare. You don't get to keep your transplant for 47 years without good healthcare. And I've been very, very fortunate in that. But my passion is to make sure that information from the National Kidney Foundation we have in where is that? Lutherville, Baltimore, wherever. Patty Dash has helped me in trying to get information out and so forth. So that's my passion for 40 some years. Before I got my transplant, I was speaking to doctors and nurses that are probably already gone to glory by now as to what we needed as patients on dialysis and to get transplants and so forth. So I would say follow your passion. If you have a passion to help, then help. That's it.
Thank you. Thank you for that. And Miss Deborah, what about you? What would you offer to someone just getting started? What are some words of wisdom?
Well, I'm listening to George, and I believe that follow your passion. And Lois says she's following her passion. Mm-hmm. My passion is to catch the people before they get to the point where they have to have a kidney transplant. Yes. I've talked to people doing screening calls and that type of thing. There are people that honestly do not know that they are at risk for kidney disease. They have high blood pressure, they have diabetes, but they don't know they're at risk. So something has to go on down at that level so that people are making changes in their lifestyle. And personally, what I do is when I have family reunions, I look online to find free giveaways as far as information on lowering your salt and sodium intake, reading labels, cardiovascular disease risk factors, those types of things. I find those things, and I said, there's no way I can sit every day and work in the center and do what I do without sharing that information with my family or any other small group. Starting there. So I definitely do that at a family reunion. I put those papers out and people, my family members, but I said, wait a minute, come over here. I have something for you because I know you have high blood pressure. I call them out because a lot of people, like I said, from doing screenings, they don't know they're at risk. They don't know they're at high risk. Doctors may be telling them, but they're not taking it seriously. So that's where I start. That's my passion.
It's wonderful. And I have to get you at the next Cruz family reunion with all that, with all of those practices for sure. Open invitation. So, and so Lois, what about you? So what sort of advice would you give for people just getting started with this sort of work?
Yeah, so I would say that it kind of builds on what's already been said. Just being authentic to yourself, right? So while I'm interested in how teams work together and things at the systems level, maybe someone's interested in kind of children and children's health. That doesn't mean then you should do the type of research I do. Maybe it's not even research. Maybe it's helping with school lunches in some way, or helping being on a board or committee that really thinks through health for children or activities for children to keep them active. Maybe it's mothers and how they can help their children with health, but how can the mothers help their own health in addition to having children? I think what comes naturally to me is talking to people. So my kind of nugget would be to talk to as many people as possible, to just keep learning, because it's an ongoing process. And I think it requires a little bit of self-awareness of what you do know, but then also recognizing that there's a lot that you can learn. And that's where kind of each other, like there's the benefit of learning from each other. And just staying open-minded, knowing that it's uncomfortable to sometimes realize that there were holes in your understanding or how you were approaching something. But I think there's great benefit in that too, because that's ultimately what we're trying to get at, kind of filling the holes in things, whether it's the holes in services, the holes in understanding, to achieve the larger goal of having systems and services just work for people at large. So yeah, that's talk to people and stay open-minded, and just staying authentic to yourself is what I would say.
Sage advice. So George?
Yeah, I wanted to say, because we all mentioned children, and I think that one thing that's not being done, I mean, even when we're trying to get into the schools to speak about signing up to be an organ donor, we have got to get the kids as in elementary school. I mean, by the time you get to high school, you've already developed poor eating habits, and they're putting vending machines in the schools with potato chips and things that are full of salt. So we really got to get to the kids and to their parents. This has become a generational issue where the parents are maybe poor eaters, and so they pass that on to their children and so forth. And that's where one of the other committees, that the Nuts and Fruit Committee, comes into play, trying to eat healthy. Because by the time, now I came down with kidney disease when I was 16 years old. I had a disease of the kidney. I'm still as skinny as I was when I was in high school. So I haven't gained much weight or anything, but we've got to reach the children, I think. And that's where a lot of the problems with dealing with health start.
Well, thank you for those wonderful words of wisdom. There was a question. Maybe I'll see if one of you wants to take this as we sort of come to a close here. But there was a question really around from Dr. Ibe around what types of things, given that you're health equity warriors, really, each of you, in the work that you're doing, what sort of things do you do to sort of preserve your own energy around this, and how do you care for yourself so that you're around, to continue to do this work? And so, anyone want to hazard a comment on that?
Well, I'll say something. I think I got to an age where I realized that a lot of the advocacy work, and of course that's changed because I've gotten back in the middle of it, but a lot of the advocacy work, I think the young people should be involved in. There's a young man that we really need to reach out to. His name is Austin Lee. And if there's anyone that's an advocate for healthcare, for fairness and equality, anything dealing with kidney disease and transplantation, he goes down to Children's Hospital to constantly speak to the children and their parents about kidney disease and so forth. I've just tried to stay in touch with what's going on. That gives me encouragement. And I formed a group called the Quarter Century Club for Long-Term Transplant Recipients, because we have our own set of problems dealing with 30, 40, 50 years of steroid use and so forth. So I think constantly educating and staying in touch with those that I've spoken to or come across has encouraged me and kept me going.
That's great.
George,
Thank you. That's how you're sustaining. Mr. Purnell, you had a...
Yeah, just to comment on what George, I'm glad you said talk to the kids and get the parents involved.
Yes.
One of the biggest mistakes Hopkins made here was they concentrated heavily on educating the kids on how to eat correctly. But when they come home and they're hungry and their mother throw a chicken box on that table, they're going to eat it above anything else. So they don't have a whole lot of say in what they're going to eat. And we need to keep that in our forefront of our minds, that we have to get the parents in there and show them. That's another thing. We give away food every week. And many of the people, you see the squash and the zucchini and so forth being thrown away because they don't know how to fix it. They're not familiar with it. And, you know, there's some of the things that could keep their kidneys in good condition if they were eaten correctly. But if we don't get people in there to teach them how to prepare some of these meals, you know, many of their parents don't know how to prepare them. And I've talked to some of them. We used to have a class here at the center when we were doing the food back in the early 2000s. And we used to have people from the health department come in and teach a class. Every day we gave away food, they would have a class upstairs. And they would show them how to prepare whatever was in the box for a good meal, you know, a low-cost meal. And then the state stopped letting the workers come out, so that class ended. But we need to do some things around that area if we want to reduce the amount of people that have bad kidneys and so forth.
I agree.
Well, thank you. I think we're gonna need to kind of wrap things up here, but Dr. Cooper offered some a bit of a response about how we can really try to feed ourselves physically, mentally, emotionally, and spiritually in order to be able to sustain ourselves in this work. And so I want to invite all of you that are tuned in to join me in thanking our fantastic panelists who we've honored today and have been so honored by for the comments that they've shared and the wisdom that they've offered us. And I also want to thank Dr. Cooper, as many have said in the chat, for really being a health equity hero of heroes that we've all certainly benefited from, and for also being a partner in this program this afternoon. And I want to give a huge special thank you to Nicholas Dominguez Carrero, our very own Nico, for putting this program together, really, and this would not have happened without Nico. And so I will turn it over to Dr. Cooper in case she wants to make some final remarks to close us out.
And the choir.
I know, really. I'm not even sure what I could say that would that would be better than what's already been said. I'm just I'm almost speechless because I'm so inspired by everyone who's been here and what you've said and what you've shared and your authenticity, everything that you've brought to this session. It just means so much to all of us. And I'm inspired by Dr. Cruz, who actually, this was her brainchild for us to do this. So I think we should give her a round of applause. And I just want to say, yes, this has been a beautiful day, and hopefully it's been inspiring and energizing to all of us, and we can carry this with us and know that we are here for each other, and we will continue this work as we move forward.
Yes.
So thank you.
Yes.
Thank you.
We'll see you next month, if not before.
Thank you. Great session.
Thank you so much.
It
Thank
was.
you very much.
Thank you so much.
George, don't forget our chili.
Thank you very, very much. Thank you.
Thank
What's
you.
up, see the moon?
Bye, everybody.
Thank you, Nika.
Bye.
Bye, everyone.
Michelle.
Bye.
All right.